Welcome to the Home Healthcare Today show. I'm your host, Dr. Cleamon Moore.
Making every promise complete.
It is May, and May is Women's Health Month. But in addition, it's Mother's Day weekend. Yes, tomorrow is Mother's Day. So we're really excited about this episode. A quick stat: women make 80% of the healthcare decisions for their families. Women schedule every appointment, fill every prescription, stay up at night with every sick child, but 8 in 10 women don't get the recommended physical activity that they should. Not because they don't know better, but because they're oftentimes too busy taking care of everyone else. But who is going to take care of the special woman in our lives? Today's guest, Dr. Kania McGee, MD and MBA, is an obstetrician gynecologist at Corewell Health, Grand Rapids. Dr. McGee specializes in obstetrics and gynecology. She has 18 years of experience and is board certified in obstetrics and gynecology. She is a physician executive focused on advancing clinical outcomes, maternal and infant health, and data driven healthcare transformation by aligning clinical strategy and community informed care. Dr. McGee leads strategic priorities that help healthcare teams translate data into action, strengthen clinical performance, and deliver consistent, high quality care across diverse patient populations. Her work connects clinical operations, analytics, quality, safety, patient experience, population health, and community health partners to improve outcomes at scale. She is known for advancing practical, measurable solutions that reduce unwarranted variation, support care teams, and create lasting improvements for patients, families, and communities. Dr. McGee, welcome to the Home Healthcare Today show.
Thank you so much, and thank you for having me.
Pleasure's mine, Dr. McGee. Did I miss anything in that overview of that introduction of you?
No, I think that was a great overview.
Yes.
I also practice pediatric and adolescent gynecology,
Okay.
and I combine that with my work for the Equitable Outcomes team at Corewell Health.
Okay, thanks for that, Dr. McGee. Dr. McGee, yes, it's Mother's Day is tomorrow, all right? And we know that for close to 2 decades now, you've been helping women at every stage of their life. When you look at the state of women's health in America, what keeps you up at night?
I think that is a really good question.
Yes.
I will start by saying how much progress has been made over the decades when it comes to women's health. There has been a lot of change in what women's health physicians look like, as well as other providers such as certified nurse midwives
Mhm.
and other advanced practice practitioners like physician's assistants and nurse practitioners. But we went from a time where it was predominantly men, physicians, and other providers to now predominantly women
Absolutely.
physicians and other providers. And while we still have all providers, there's been a change in conversation.
Okay.
And what really keeps me up at night is we still have some things that we need to do as a society. And that is to make sure that every woman that comes into the healthcare system has the best opportunity to achieve their optimal health.
Absolutely.
So that means getting the right care to the right person at the right time,
Mhm.
every time.
Every time. Every time. Okay. Don't want to miss it, Dr. McGee. So as we think about this, there are a lot of women that are perhaps watching that haven't seen a doctor regularly. Some may have not seen a doctor in years. Perhaps it's out of fear, perhaps it's out of a lack of time. What would you say to folks that just haven't had time or have some concerns about going to see a doctor?
Absolutely. The first thing I will say is it's okay.
Hmm.
There's never a time that's too late to get plugged back in with the healthcare system.
Hmm.
And so if it's been years, that is okay.
Yep.
What I will share is if we start with maybe fear
Yep.
and that opportunity that we as a healthcare system, it's the onus is on us to be a trustworthy place to come.
Absolutely.
And that starts at the individual level with relationships. So I always like to share, if you are seeing someone for care, do you feel comfortable with them?
Hmm.
Do they give you that space to share more about who they are as a person? And more than just what that visit is about for the day, and that relationship is built over time. And so the first thing is just being able to take that next step. Doesn't have to be all of the steps all at once, but take the next step to get in for that appointment. For some people, it might be because of access. Maybe there are challenges with whether it's transportation or maybe cost is a concern. But there are definitely healthcare systems out there, offices, clinics that take that into account. So, really, just beginning with that first conversation in the healthcare system, getting plugged in with a visit, and then being able to share that information once you feel comfortable.
Absolutely. Okay, Doc. So, not to go off tangent here, granted that it is Mother's Day weekend, I do think about my late mom. And unfortunately, she had a autoimmune deficiency called Sjogren's syndrome. And Sjogren's impacted or affected her health in so many different ways. So later in her life, she was diagnosed with CHF, congestive heart failure. And we understand that heart disease is still the leading cause of death in America. But there's still a disconnect with a lot of folks thinking about heart health as related to overall health. Why is there such a big disconnect?
First of all, thank you for sharing that personal story
Yes.
about a family member. And I know that probably resonates with a lot of the viewers today.
Certainly, certainly.
Um, but what I will say is that when it comes to heart disease,
Yes,
for many decades, we often thought about it in terms of something that impacts men.
yes.
And so there has been a lot of education, not only to our public, but within the medical
Hmm.
system around heart disease as it relates to men.
Yes.
But we do know that heart disease is the number one reason for death
Hmm.
in women as well.
Yes.
And now we have a lot of intentional education around that.
Okay.
I know that this is not the month of February, but
Sure.
February
Sure.
actually is Heart Health Month,
Absolutely.
and as it relates to women. So that's an opportunity to have education around the signs that might be a little bit more subtle
Yes.
in women than it is in men. That's an opportunity to educate not only women, but the people that care for them, their family members, their friends, their communities around this information. So while we are making progress, we still have a way to go.
Yes.
But it's really about continuing that conversation and going back to what I originally talked about is being able to get into the healthcare system and have some trust. We
Absolutely.
want you to get your blood pressure checked and
Definitely.
your cholesterol checked and all of those things.
Wonderful, Doug. And thank you for going back to discussing, February as American Heart Month. We had an episode of the Home Healthcare Today show where we honed in on heart health, and then we even honed in on maternal health, which is the segue to the next question. Okay, as we think about moms and maternal mortality as a crisis in America, it seems to be getting worse. Uh, Black women are 3 times more likely to die from pregnancy related causes. As an OBGYN, how do you see this playing into your practice and what needs to change?
When I first went into medicine, I think what
Right.
medicine prepares the individual for is that specialized one to one care that we provide patients. But what I have done in my career was to take a step back because there's only so much that we can do face to face during a medical visit. But what more can we do to support our communities?
Yes.
And so when I think about the work that I'm doing around equitable outcomes,
Yes.
we know that there are other important professionals
True.
that can
True.
help.
Hmm.
And so while we have physicians and certified nurse midwives and other providers in the healthcare system, We also have those who are working out in community. So if we think about community health workers, or we think about doulas, and I'll just use doula as an example. Doulas can support patients in the prenatal component of that pregnancy, so helping to go to visits. They provide support during labor, but they also provide support postpartum. And it
Mhm.
is an extension of the care that might be confined to a certain visit, a certain
Mhm.
amount of time, but to turn it around and have a holistic approach to providing that support, I think is really key to addressing some of the concerns around maternal health.
Absolutely. Yes, Doc. So we also honed in on doulas, in an episode, and community health workers oftentimes are the unsung heroes,
Absolutely.
in the communities for sure. Okay, you're taking care of women of all stages and ages, but let's go back to pediatric and adolescent gynecology. Why is it so important to start the conversation about women's health when young girls are actually growing up and maturing? And why should parents have those very important conversations with their daughters?
And thank you for that
Yeah.
conversation. I have spent most of my career as a general obstetrician and gynecologist, but since my training, I've always had an interest in the younger population. And so, about a year and a half ago, I was able to really hone in on this particular conversation as it relates to the younger population in pediatric and adolescent gynecology. What I've learned is that trust,
Hmm.
it begins early.
Yes.
And so I take care of toddlers through young adults through
Hmm.
21 years old.
Yes.
And so that trust is not only with my patient that I'm caring for, but it's their family as well.
Absolutely.
And so that is an opportunity to really begin to open up conversations about things that may not always feel comfortable
Yeah.
with individuals or with families.
Sure.
And
Sure.
so what I find joy in is as my patients get a little bit older, and that
Yeah.
might be different for all of them. I
I
have
get it.
some that are
Okay.
elementary level that are
Uh-huh.
beginning to ask those questions
Yes.
that they might have. And I encourage that all the way through my 21-year-old. So what
Okay.
questions do you have? Did I say something that you still have questions about? What are
Sure.
your concerns?
Definitely.
And I also think it's that connection. I want to know what my patients do outside of this exam room. And
Absolutely.
so, if we want to make sure that we can optimize what life is like for you outside of this exam room, I need to know what you do. Are
Totally.
you involved in sports? Are you
Yes.
involved in music? But it's really making those connections so that they feel comfortable because it is something that they will be doing the rest of their lives.
Hey, we're headed to a commercial. We'll be right back.
Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot.
Hey there, folks. Welcome back to the Home Healthcare Today show. We are still focused on Women's Health Month as well as tomorrow being Mother's Day. All right. I certainly understand that this is not only important information, but there's a certain sensitivity that we would like to bring to the next half of the segment here. We understand that there's some folks out there that are perhaps grieving the loss of mom, right? The loss of a daughter, loss of a sister, grandmother, etc. So very cognizant of that. Um, and speaking of which, mental health. So we understand that oftentimes emotions are triggered by events, right? So Mother's Day is an exciting event for many, but it's also a troubling time for others. Dr. McGee, back to you. And with this mental health bend here to our conversation, what are you seeing? And how do you cope, with multiple roles as a mom, as an MD, and how do you help patients balance their mental health wellness along with their physical wellness?
Absolutely. Thank you. I'll start with the personal. So
Sure.
I am a mother, I
Yes.
have 3 children, and really community for me,
Yeah.
is very important,
Absolutely.
whether that is, family, or whether it is the neighbor
Yeah.
or people in the neighborhood that can help. And so it's important to realize that, as we navigate
Hmm.
our day-to-days, that we don't have to be alone, and if we need help, how do we get that? And for some people that may not be as easy as others. When it comes to the healthcare system and getting medical care, what's also very important is the shift we're making around mental health really is not different than emotional health or physical health.
No.
I like to think of it as health overall. It's really a holistic approach.
Yes.
And so, as a physician, how do we understand the needs that our patients have, which begins with trust? Our patients can trust us and can share if there are concerns. And then, how do we take that and help connect the dots to those areas that can help, whether it is community resources or other resources?
Wonderful, doctor. Okay, we get a lot of things right in America, for sure, right? Greatly due to women and women's impact, right, on not only the lives of children and families, but within professional careers and industry. With all that being said, and you talked about neighbors and community and all of that, right? What do we tend to get right from a system standpoint? And what are some things that, as a society, we can do to improve outcomes and the state of women's health?
Absolutely. I think it really builds on what we've been talking about today. I think what we get right is, as a healthcare system,
Yeah.
we know what high
Hmm.
quality healthcare is.
Yeah.
But where we still have areas of opportunities around the state, around the country, is how do we make sure that high quality care makes it to every patient that comes through our door?
Yes.
And what we know right now is that depending on who you are as a person, where you live, what type of access to care that you have
Hmm.
makes a difference in outcomes. And so that is not on patients,
No, it's not.
but it's on the healthcare system to build and design a system that accounts for those things. And that's going to be a little bit different for each individual patient and also for different communities. And so we need to take a step back and think about design. How do
Yes.
we incorporate that quality and safety into what's specific for the communities we're serving?
Absolutely. Now that's the segue to social determinants of health. We don't just go down social determinants of health like a checklist and say, okay, transportation, safety, education, access to food, and all of that. We like to mitigate the factors. What currently do you see the OBGYN community doing to directly mitigate factors?
I think one is just starting with education.
Yes.
Um, as a faculty member at a medical school, we're
Mhm.
actually teaching our medical students about this.
Good.
Also, our resident physicians who are in training, they've graduated from medical school and
Mhm.
now they're doing 4 additional years of training in OBGYN. They're learning at the beginning
Good.
that these are contributors to overall health.
Yes.
So again, it really takes, it's not that it's inherent to
Right.
patients, but that it's within this system. And if we have access, because we've asked
Yeah.
about social drivers of health,
Yeah.
then we have that opportunity to, again, connect the dots. So we wouldn't be able to solve it in a visit, but if we're asking the questions, we know when an individual patient may need some additional assistance.
Absolutely.
Many healthcare systems as well are standard screening for social drivers of health. And so that takes the guesswork out of, at the individual physician or other provider level. Um, but now, are you paying attention to that and getting the patient to the next step?
Okay, got it. All right. So this is good to know, right? That practices as well as systems are working to mitigate the factors. I know I got some moms, some grandmas, some aunties out there, right, that are really thinking about this from the standpoint of, but I got so much going on. Um, what's the one thing, or what are a few things individuals can do if they're saying, today is my day. I am going to focus on my own health, right? What can they do? Because my kid's gonna take me out to dinner tomorrow for Mother's Day, right? And they're gonna bring gifts over. But in spite of all that, or in spite of all that, what can I do today?
Yeah, absolutely.
Yeah.
I think what you can do today is really just make a decision that you are going to prioritize your well being. But it doesn't have to be a long plan. It doesn't have to be as written out and
Nope.
hung up on the wall and looked
Nope.
at every day.
Right.
But again, what are those small steps?
Yeah.
And I think it begins with the decision.
Yes.
Maybe the next decision is making that appointment.
That's it. Oh, yeah. Making the appointment. And I'm reflecting now. I think about my wife. I think about the women, in my life, and even my late mom. And I think back to like mom just getting a huffy exercise bike from Kmart, like back in the day. Like
Puffy.
she got a huffy
I hadn't thought about
exercise
that in a
bike,
while.
and it was in the kitchen. But I'm not realizing then that that was the one decision that she made, right? To just integrate exercise, Yeah, but the huffy.
One thing I would add to that
Yeah,
is the airlines get it right.
yep,
Before we take off, they tell you about all of the safety measures.
yeah,
And one of them
mm,
is if the oxygen mask come down
yep.
and if you have a child next to
Come
you,
on now.
they say put on your oxygen mask first
First,
before you help
they
others.
do.
And I think of that as well when it comes to how we mother, because sometimes women are mothering, even if it's not their own children, they're mothering others in the community.
Yes.
Friends are helping to mother,
Yep.
aunties, grandmothers.
Yep.
And so, but in order for you to do that well, you have to think about your wellness first. And so if you are healthy and taken care of, and when you feel like you need some rest, you're
Yep.
getting that rest. When you
Absolutely.
feel like, hey, it's been a while, I should make an appointment.
Yes.
It doesn't have to be a selfish thought, and it shouldn't be,
Absolutely.
but really it is thinking about yourself so that you can think of others
Amen. In a guilt-free way.
in a guilt-free way.
Absolutely, Doc. Okay. You've been noted or identified or described by patients as being kind and gentle and someone who makes sensitive appointments feel safe. In a healthcare system, from time to time, just generally speaking, healthcare for a lot of folks seems to be cold and somewhat transactional. Dr. McGee, how do you make it a transformative, warm experience for patients?
So first of all, I feel honored and privileged to have that feedback
Yep.
from some of my patients. I really believe that healthcare within a healthcare system does not have to be cold or transactional, but it is up to the healthcare system to make sure that it is not. On a personal level, I want to make sure that when a patient comes in for care, they're not being judged. They're being addressed in a way that they want to be addressed. They have that space to talk about their concerns or fears or what they would like to see. So, really, it's just taking a step back and listening. Yes, I'm on the clock and I have
Sure.
another patient being
Sure.
roomed, but if I don't listen to my patient, I'm going to lose any opportunity I've had
Facts.
to be able to understand how we can think about that holistic approach to their healthcare.
Absolutely. And the patient that's in front of you is indeed the most important patient, for
Absolutely.
sure. Doc, if you had a magic wand to wave over this topic, generally speaking, working toward optimizing health outcomes for women in America, you wave that wand, what would you fix?
I like to think of it as twofold.
Okay.
So one is just the advice around put on your oxygen mask first, and what are
Mm-hmm.
you doing to care for yourself, and not thinking about it being selfish. The second thing is I will put that on the healthcare system.
Okay.
We need to continue to better understand our communities so that we know where there are areas of opportunity to connect the dots. What's the next step? This is what I can do during this appointment, but what's the next step so that it can help you on that journey?
Yeah.
We know, for example, that just having patients come in person is not always the best solution. Sometimes it might be telehealth, for example. How can we reach the patient where they are? And I think that healthcare systems are really thinking through this, but we should always be evolving. We've never arrived. And, so what is that collective voice saying? How can we get from being that cold feel
Hmm.
to more of that personal feel and getting the patient what they need?
Absolutely. Very good. All right. That's a magic wand. I get it for sure. Doc, we had a little more time, so I got a wild card for you. Oftentimes we seem to learn reactively or retrospectively. For students out there that are considering healthcare as a track, right? What would you tell your younger self about the healthcare journey? And what are some things that will motivate this new generation of healthcare professionals? Mhm.
What would I tell my younger self? Um, I would say just keep doing it,
Keep doing
keep
it.
pushing.
Yeah.
I think that for a lot of people, the healthcare field, especially the medical field and going to medical school, and there's plenty of ways to impact patient care besides doing that. But it seems so far off for many people. Oh, you have to be perfect in everything in your studies
Yes.
in order to do that. But I know that not to be true. I think it does require a lot of that hard work, but we all come from communities
True.
and we all know what that's like, to have family members or even our personal selves. How do we want healthcare to look like? That voice is so important.
It
And
is.
every generation that is coming up is going to be contributing something a little bit different. Whether it's a
Absolutely.
generation, yes, give me that virtual health appointment,
Yep.
or whether it's, nope, I want to come see you in person. And that's
Absolutely.
okay. So I think we have to remember that those that are in the healthcare system are a part of communities, different ones, and
Absolutely.
we all bring those perspectives. But we need perspectives from
Totally.
all communities.
Totally, totally, Dr. McGee. I love it. You lean back, you rewinded 18 years. Now we're going to fast forward as we close out this episode of Women's Health Month, as well as our special Mother's Day episode. Let's fast forward 18 years ahead. I know, right? From a legacy standpoint or a legendary standpoint, Dr. McGee, what do you want your greatest accomplishments, quote unquote, contributions to community and health, what would you want them to
I think on a patient level, I just want my patients to feel heard, safe, that they can trust me to help guide what that healthcare looks like, help provide recommendations and have an honest conversation with them to get, that engagement and how they want to move. So that's one. I would say on a system level, I just want to have an opportunity to help create a change within the system. What does that design look like? That would be just a little bit more ideal for now. And I also want others that maybe are not a part of this work yet to come into this work because we need a lot of hands on deck in terms of what that looks like. And lastly, I want the communities that we touch to really feel like it made a difference. That we are not, cold or transactional, but that we're actually doing something that was important in their community.
Yes, absolutely. Now that's a vision for the future, and a vision worth us all working hard to achieve. All right, folks, that does it on this special episode of the Home Healthcare Today show. Wishing every mom out there a happy Mother's Day. Stay tuned next week at 10 a.m. for the Home Healthcare Today show.